South Africa entered into its first week of phase 2 of the COVID-19 inoculation. In this phase, we saw more healthcare workers and persons over the ages of 60 getting their vaccinations across various sites in the country. The phase is set to have ended on Friday with only over 100,000 people inoculated, despite the government's initial projection of 250,000 a day. Many concerns have arisen regarding side effects, particularly for those over 6 years of age with comorbidities. To find out more about some of the alarms that may have come from patients over 60 about vaccine side effects is medical doctor Tiny Mhinga. Dr. Mhinga, very good morning. Thank you for speaking to us. Let's talk about potential or possible side effects for those over 60.
Good morning. Look, thanks for inviting me. As far as we are concerned, even if there are side effects, I think what is very important is that at least somebody is getting somewhere. They are getting something, a vaccine. The side effects, yes, they are there, but they're not so serious. I mean, people will end up with things like headache, pain on the side of an injection, some kind of dizziness, muscle aches. But remember, these things don't last any time. It doesn't last forever. Maximum probably about 48 hours, and then it's all gone. So I think it's something that is, the vaccination itself outweighs any form of side effect that people experience.
Can any of these side effects be permanent, or is it all temporary, as you say, fading or going away after a few days?
I like your question. I think it's a very important question, the way you've structured your question. The effect of coronavirus, some of the side effects can be permanent or they can last for a very long time. But none of those side effects from the vaccine are everlasting. I mean, surely we have hardly seen anybody who's got the side effects for more than 5 days. So it's something that one can tolerate and you can live with rather than to avoid a vaccination.
Dr. Mhinga, you talk about we've hardly seen anyone. It almost suggests that South Africa is monitoring the possibility of side effects. Do we actually have a system in place? And if so, what is that system to monitor those patients that have had the vaccines given?
I think what is happening is that most people, they make a mistake of when they experience certain side effects, they post the so-called side effects on the social media. Go back to where you have been vaccinated, your vaccination center, and tell them about the side effects, rather than to just broadcast them on the social media. It's not helping anybody. So it becomes a little bit difficult to document the side effects, because people don't go back to where they've been vaccinated from. So what we have now, it's a non-structured complications or side effects. We don't actually know whether this is actually true. But I will urge anyone who has been vaccinated, who started to experience side effects, to go back to the center itself and talk about and tell them about the side effects. But what they have found out, of course, we can only learn from those countries where they've had a massive vaccination drive. People who have had side effects, most of the side effects are related to anxiety of not knowing what actually is going to happen. So no one has ever been admitted because of the side effects. No one has ever died because of the side effects. Probably people are talking about some mild side effects which won't even last for more than 48 hours, the most.
So outside of actually going back to the center when you have side effects, what would be a practical guide or certainly advice on what to do from home when you experience these side effects?
Look, we're all given cards which has got a center number, your center, the date of vaccination, and who actually vaccinated you. Call that number so that it should be known. And if it's anything that is serious, they would ask you to come back to the center, and of course, the side effects can be dealt with. And I think those who are vaccinated, they know that you don't just vaccinate and go back home immediately. You have to hang around in the hospital for the first at least 30 minutes. The reason for that is that there are people who naturally will get side effects from an injection, either something that has to do with overreaction or anxiety, or what we call anaphylactic. We've never seen that. what we call anaphylactic shock, where somebody even loses the pressure in the cardiovascular system. But if it happens, there's always somebody on site to try and deal with the side effects. So I would say, and I want to urge the public to say, take a chance, go out there and get vaccinated. I think that's the most important thing. The side effects of coronavirus infection or the disease coronavirus infection is much more severe than the actual side effects. People talk a lot, and most of the people that talk about things that they don't even know about, they are not structured, they cannot be verified, simply because, like I said, people don't go back to the center where they were vaccinated to give the actual report. So what me and you are dealing with, we're dealing with information that comes from just the public or the social media, which is not verified.
Doctor, have you been vaccinated?
Well, I can tell you, I vaccinated about 2.5 months or 3 months ago. I was vaccinated. The same day that I got my vaccine, let me tell you, I came back to work. After working at 5 o'clock, I went to the golf course. I played 9 hole. The following day in the morning, I went to play another 9 hole again. So it all depends. And of course, I didn't expect anything to happen to me. I even forgot which side of my body I was vaccinated, because I didn't feel anything. But I'm sure people do feel a little bit of pain. I have some of my staff members here who were vaccinated. The following day, we asked them to stay at home because they felt a little bit of a headache. But if you do get a headache or any form of pain, take a painkiller, stay at home, sleep for a day, hydrate yourself, that is, take enough fluids. The following day, within 48 hours, you're back at work. So it's not a permanent side effect. It's, like I said, most of the time, the reason for that is because of anxiety, not knowing what is going to happen to you.
Dr. Mhinga, there have been some calls for people over 60 years of age to take the flu vaccine ahead of the COVID vaccine. Have you come across that content? Do you have a comment regarding that?
I've heard. And of course, we as private practitioners were at an advantage because we know who our patients are, unlike probably the public service where everybody walks in there. We get questions from our patients to say, can I take a flu vaccine? Number one, am I the right person to take a flu vaccine? This week alone, I've had 2 overseas who came to me and said, I always react when I take a flu vaccine. And those are kind of people that you have to note, because you cannot just send them immediately for a coronavirus infection. Because I didn't know what to do, I had to consult with people who are doing this here and internationally to find out exactly what do we do with people who always react to a flu jab. And I had to put them aside and say, for now, don't go there until we have the right information. You must also remember that this condition is a new condition for every one of us. So we still don't know exactly what happens to people. So those kind of people, I would not put them at risk. I've asked them to I'm using the word step aside, to stay away for a while until we know exactly what is happening to them. So number one. Number two, there are those who actually have the side effects like clotting. And if you've got a tendency to clotting, we also ask them to wait for a while until we make sure that their blood clotting it's under control. And of course, if they've got other comorbidities which may interfere with the vaccine, of course, they are always on our watch, and you cannot take them for the flu virus vaccination until we know exactly. So those are the kind of people that I would say stay outside for a while until we know exactly what's happening. It's not something that is going to take more than a week, but we'll have the information at hand because we do contact other people outside this country who have got better experience than what we have.
And finally, Doctor, there are individuals that potentially could have allergies to drugs or chemicals that are in the vaccine. How do you deal with those? Is there any way of monitoring before they're actually vaccinated?
Well, I think, like I said, I think it's in the profiling of the patient. We always try to profile our patient. We have the time to do so as private doctors. Like I said, we know who our patients are. We know what their conditions are. So it's not that we encounter our patients only at the time or date of vaccination. So we have a profile. The patients that I'm talking about, these are my patients. And I think it happens to all the doctors, whoever they are, private doctors, because we know who we're dealing with at all the times. So your patient that is coming to vaccinate or we're going to recommend for vaccination, we know who they are, we know what their complications are, we know the kind of conditions that they have, we know their underlying conditions, and we advise them accordingly. So like I said, number one, those who have got a clotting problem, because it has been reported widely that some people developed clotting. I'm not going to subject a patient who has a clotting problem to vaccination yet, but we'll try and work through their clotting process to find out if they're okay. And if they're okay, is that we can say, yes, step in, go in and get vaccinated. That's number one. Those who have the tendency to allergies, we put them, make sure that we know exactly what's happening to them before we can send them. I've got, like I said, 2 patients who are in that kind of category. For now, I've asked them to wait for a while until we have all the information. And I think most of the doctors are doing the same thing.
Dr. Mhinga, thank you for your time this morning. Medical Dr. Tiny Mhinga speaking to us about COVID, certainly in light of the over 60s getting vaccinated in the last week.